Hi there, Dr. Edwina Coghlan here just to talk about your up-and-coming procedure, which is an endometrial ablation. So I wanted to think about 3 parts for this video. The first part is on the day of surgery. So you won't be able to drive for 24 hours. We need someone to drive you home after the procedure. It's like you'll go home 1 to 2 hours after the procedure when you've had something to eat and drink and you're able to pass urine. You can have some discharge after the procedure, as we do burn out the lining of the womb. So you may go home with some antibiotics, which we'll give you on the day of the procedure. It takes around 20 minutes to do, not too long at all, and you should be able to go back to work in the following 1 to 2 days. In terms of thinking about risks, so infection and bleeding is not uncommon. There's a small chance of putting a hole in the womb, which I would have talked to you about. You tend to be at risk of that happening if you're very, very young or you're in the menopause. And so that's often not the group of women that are having this procedure done. Sometimes as well, we can do a perforation if the uterus is big or it's sitting in a funny position. We know that on the day of surgery, and I'll let you know. In terms of the device itself, there is a risk that I'm not able to deploy it on the day of surgery, so I can't complete the ablation. Sometimes I'll talk to you about having a marina inserted if you want it as an alternative, or sometimes there is a risk that waking up without the procedure being complete. Just a reminder that 60% of women don't have any bleeding after this procedure, 30% have a massive reduction, and 10% of women are not happy in terms of their overall bleeding and pain, and so they still go on to want another procedure, including a hysterectomy. Make sure you reach out to my rooms if you've got any further questions. Please read the pamphlet I've given you from RANZCOG, and I look forward to caring for you on the day of surgery.